This could be a
So
good segue. I wasn't planning on talking about this, but I can show you some stuff on injuries if you'd be interested in that.
yeah, let's
We can
go.
we can we can pull some stuff up here on this. I think injuries is always an interesting conversation, and I very often bring this up with bodybuilders. And what I say to them is they get a niggle, they get an injury, like they hurt their knee, for example, doing a leg press or a squat or whatever it is, or a leg extension. They say it doesn't hurt when I deadlift though, so I don't do quads really that heavy, but I'll still do a deadlift where I'll do 200 kilograms through the knee joint. And I just look at them
Hmm.
like, right, okay. And then if you speak to like anyone that's a physiotherapist or works in sports therapy or works in high performance sport, and by I mean high performance sport, I mean professional sport, soccer, rugby, anything like that, they'd be horrified because they probably have you on crutches, feeling like
Mm.
you don't really do a great deal on this. But bodybuilding is a sport whereby we will still train at that high intensity despite the injury. So I think this context will be nice for you, and I'll show you this on here. We'll share the screen on this because I think this always works really well on this one. So here are just some general things on sports injuries, just on time frames. You can see here. I forget exactly where I took this from, but you can see, for example, like you get rotator cuff tear, 6 to 12 weeks, so 3 months. A meniscus, 4 to 8 weeks. That's another common one on there. Tennis elbow, 4 to 8 weeks. So you get that tendonitis. That's probably about right. It hangs around for 2 months. Disc herniations, 12 weeks, potentially longer. But this is the context that I wanted to sort of show you. So we've all had a cut on our arm. And we all appreciate that when we get a cut on our arm, that you get these different stages of the healing process. So firstly, you get the bleeding around the
Yeah.
area. So that happens immediately after the bleeding happens. You get the inflammation around the area. So your body cells send specialist cells to that site from your immune system called macrophages, neutrophils, etc. And what they do is they start mopping up the damage which is around the area. And what I think a lot of people don't appreciate is that macrophages and neutrophils and things like that, they're dumb. So they will indiscriminately attack necrotic tissue and healthy tissue, which is why it's so important to get the inflammation under control as quickly as you can, because you
Yeah.
can cause damage to that healthy tissue. And then after that, you get this remodeling phase. So you get proliferation, a lot of cells turn up in the area, and then after that, you get the fibroblasts being laid down the new tissue, and you get that scab which you've all experienced. And then over time, that scab comes away, it smooths down, and then you get a bit of scarring, and you might have that scar for like a year and then it'll maybe disappear. Or in our case, James, it lasts a little bit longer. But this is also important context as well, is that people don't appreciate that these processes are happening simultaneously. And this is interesting, I think. So although you can start to feel better because some of that pain has disappeared, and some of that inflammation subsided, and your body's already starting to move on to these proliferation phases, and then onto remodeling, there can still be overlap going on at the same time. And although I've shown you that initial injury timeline, if you're not managing yourself like you're doing and doing the right things whereby you're taking the load off the areas, letting it recover, you might get setbacks because you've not fully laid down the tissue as effectively as it could possibly be laid down. And what people don't appreciate is that collagen fibers and muscle tissues are it's incredibly complex stuff. It's like honeycomb structures. Yeah, and your body makes this go of just firing a whole load of fibrogens and things like that at it initially, and it's not quite as a tight, strong structure. And then over time, what happens is it replaces those structures with the remodeling. So it does like a patchwork. Like if you ask me to do DIY, James, putting like duct tape on the wall or something, and then a proper builder comes along and goes, "What the fuck have you done?" It's like, "Yeah, mate, it was just a patchwork job until you came here," and that's kind of what
Yeah.
your body does. So I think that's kind of interesting and sort of hopefully helps people understand how complicated sports injuries are. And I don't try and address injuries or rather diagnose injuries or anything like that at all, because I just know how complicated this stuff is and how easy it is for me to make a mistake. But I thought I've got something on this. I thought I'd just fire that in there. I
Yeah.
thought that'd be kind of nice.
Yeah, I think with the with injuries, first of all, it's like anything else, the diagnosis is not the cure. The diagnosis is the first step
Yeah,
in knowing what direction to set. And particularly whenever, and I know a lot of bodybuilders, we push through injuries to
yeah,
get on
yeah.
stage. And I've unfortunately walked on stage with those injuries, which has
Me
impeded my
too.
ability to
Me too.
perform. And it's not fun. Like that's why I love phrases like don't train around an injury, train with it. It'll
Mm.
it'll it'll communicate. You'll get all this sort of receptor feedback, and what you can function with and what you can't. But ultimately, it's down to understanding the body, even mechanically, like how it's working. So, like if people know about the issue that I have is the SIJ or sacroiliac joint, and
Yep.
whenever they have like there's a little bit of pliability in this joint, so it's able to sort of just move in small degree of movements, which is essential. But so the things that I'm trying to work on is if you can imagine like standing up on one foot on a step and then allowing your other foot to go down towards the floor. So you're almost like allowing this sort of lateral movement through the pelvis and even the sort of lower spine. So you can see that SI
Yeah,
joint there.
as you say, it's
Um,
got a tiny bit of movement in it and a tiny bit of
yeah,
flex. It's not a lot. So when you're saying
yeah,
taking a step down, that's to sort of influence that little bit of rotation. Because the other thing that
that's right.
I didn't mention in any of that sort of stuff when I was talking about sports injuries is that you've kind of got this use it or lose it stuff. So if you get that injury and it seizes up, then you can end up in a position whereby you lose that range of motion for a very long time unless you do something about it, and maybe even
Yeah.
permanently. So that sounds like that's what you're doing. But yeah, I thought that image would be nice.
Yeah, if we can sort of imagine the SI having, so dysfunction comes from whenever the movement becomes more than what it's designed to move. So it loses that sort of stability of the joint. And then common knock-ons from that or side effects would be like really tight through the likes of the piriformis, glute medius, a lot of the sort of lateral
Yeah,
glute muscles, and they tend to tighten down. Then further off that can sort of kind of choke out a little bit in terms of your like sciatic nerve. There could be different things that come off that as a byproduct. The other thing is then tightness from the QL in towards the vertebrae. So you can end up getting sort of even referral into the spine. So I had this sort of collective um, zone of
mm,
dysfunction, but the nucleus was the sacroiliac joint, which a lot of times people would say like it's like medical professionals would say it's from a fall, like
mm.
coming down heavy on your pelvis. But there's I've come off cycle bikes and different things like that whenever I raced, but the first time I ever suffered with sacroiliac joint dysfunction, it was actually on a leg press, and just allowed that sort of little bit of like butt wink as I went to the bottom of that
Yeah,
active range and felt this like it felt like a clunk, like
yeah,
something just went.
like a pop or something.
Yeah, and that was 2017, and I've had the injury has come back. It's been cyclical pretty much near enough every season. I'm experiencing some form of dysfunction. So now, like, I kind of know the beast. And once you know the nature of the beast, you know how to treat it, or at least tame it as much as possible. And that's kind of where I'm at too. So the other thing we could talk about then for offset that is, as I mentioned there, and in prep, both of us were in prep.
Yeah.
A lot of the research in terms of if you listen to Mike Israetel,
Hmm.
there's things that I don't really like. Somebody saying how much volume do you need per week to build a muscle,
Yeah.
and it's such like an open-ended question. Now he has like different ranges for like minimal
Yeah.
minimal volume, MV, maximal adaptive
Yeah.
volume,
Yeah.
etc., etc.
Yeah.
So what people need to understand is you need less volume to retain muscle than you
Yes.
do to build it.
Yes.
And there's logic in these words. It's not like I'm saying anything sort of off topic here. So whenever you kind of understand that, the quality of the work for me is more important than the amount of the work,
Hmm.
particularly in areas that you have a little bit of mechanical confliction. So functional areas of your body, you can you know focus on doing higher levels of volume there. But certainly, if you've got problematic areas where there is some dysfunction on some level, then I would just be sort of taking it down to, even if you want to align with that sort of minimal effective volume, like keep the volume down, select exercises which are non-aggravating, and you don't just assess that during the exercise, you also look at what was the reaction to that exercise over the next
That's
24, 48 hour
so
period as well.
important, yeah. So important
Yeah,
because you can feel fine, like just to use an example, you can feel fine doing a leg press at the time, but if your back's sore for 3 days after,
yeah,
then it wasn't worth it. I mean, just to give some more practical context on that one. So, um, and I think that's all good advice. You might say like I've got SI issues as well from doing deadlifts, when I was a young man, and these days, when I feel like I've done enough for that particular area or that particular muscle group, I can say, right, okay, that's enough for there, and I'll cut it short. And I'm fortunate
hmm
that, for example, like I've got very strong glutes, so I don't feel the need to do lots of abductor exercises and hip thrusts and things like that. I can probably get away without doing it. And just like for the last few
100%.
months, for the last 8 weeks, I've had a bit of a knee niggle, but fortunately, I've got really strong quads. So most of my
Yeah,
workouts been around hamstrings and calves. So I've just done 3 to 5 sets of quadriceps and thought that'll do, just to stimulate on there. And that's about using
yeah,
my instinct and getting in and getting out without accumulating the fatigue and causing problems later down the line. Because I've done what you've done, trained through pain and stuff like that, and foolishly, like my back was ruined for years because I did strongman, I did powerlifting, it's very machismo, and I just took painkillers and just trained for the pain, and it was dumb. I should have done
yeah,
it, but I was a young guy and I just thought, right, this is what you do, right, hardcore, and I don't know, I think I had that Rocky Balboa mindset. Yeah,
yeah.
you know the one. You know the one. Just like
Oh, yeah.
if you're not suffering, and like adversity is good, but there's the right kind of pain.